be before 40, it could be after 60, but highest number of cases we have seen in 40 to 60. So that was the introduction. So the stages of frozen shoulder. First, initially, I'll just give you the name of the stages. First is freezing. Freezing stage that lasts for say 6 weeks to 9 months.
Okay.
And then comes the frozen stage. Frozen stage is from 1 year. Say it may go about say 1.5 years. Then after that, the last stage is the thawing stage. Thawing stage is it can last for 2 years as well. So first, in the freezing stage, your your shoulder movements would be restricted due to pain only, not stiffness, no spasm. Initially, it will be due to just pain. You won't be able to raise your arms. You won't be able to comb your hair. You won't be able to, use for any household work, daily activities.
Okay.
So that will be restricted due to pain. That stage is freezing. So right after freezing, when we enter the frozen stage, that will be your pain will start to subside gradually, and your stiffness comes into play.
Okay.
Your stiffness and your spasm will be started, and your pain will be gradually subsiding.
Okay.
That is the frozen stage. And the thawing stage would be your pain would be completely subsided. There won't be any pain, and your muscle stiffness or say spasm will be gradually reducing. That is the thawing stage, and that is the recovery stage as well. So another thing is in the frozen stage where we come into play. We physiotherapists, therapists, doctors, because when the pain subsides, we can initiate with all the stretching and any activities where we strengthen the muscles.
Okay. So what I understood was like we have three stages: the freezing, frozen, and the thawing stage. Okay. In the freezing is when there is lots of pain and where you cannot move so much. And frozen is the pain subsides and the muscle starts stiffening.
Stiffening, yes.
Okay. And the thawing is like when you're going into the recovery stage.
There's no pain,
okay,
but only stiffness remains. That also gradually
it's reducing. All right. So what I can get is like the time limit. It keeps on different patient, different.
Yeah, for different people, different patients, it varies from say somebody the freezing stage. It lasts for just 2 weeks or so also.
Okay.
And it may last for 9 months also. So that varies, and that happens for the frozen as well. And
as well as it. Any question here, guys? Before we start the self-assessment, anybody? Yes, Sarla? You're muted.
Yeah, I just wanted to know whether it is happening due to tissue degeneration.
The causes you want to know.
Okay.
Can you share us the causes?
Yes. Tissue degeneration mostly starts at the later age of our life. Let's say say after 60 years. That happens for tissue. Tissue is soft tissue, not the hard tissue like bone. So for bone as well, the soft tissue as well, it starts degenerating after a certain period of your life. So it can be due to the tissue degeneration after a certain period of your life. So degeneration doesn't happen at a young age. So for somebody say 30 to 40, so it's unlikely that the degeneration would be he or she would be having degeneration at the age of say 30s.
Okay.
So if somebody after 60, if he or she has that frozen shoulder problem, it could be his or her age. It could be due to degeneration.
But what are the other causes besides?
Okay, other causes would be, say, a hormonal imbalance. Hormonal imbalance can be, there's no age factor for hormonal imbalance. So, like hypothyroidism, hyperthyroidism, these are one of the causes, and say diabetes, because sugar content in the blood is high, so this healing capacity is reduced. So there is no enough supply, oxygen supply to the muscles around the shoulder, so there will be stiffness. So these are some causes.
And what about the blood pressure?
Blood pressure also, yes. Blood pressure, we often face this cardiovascular accident due to blood pressure, high blood pressure. So we face stroke patients. So stroke patients usually they have this frozen shoulder. That is due to the high blood pressure.
Okay. Anybody else wants to have any question here, Sarla?
No, it's okay.
Okay, Pinky.
Now,
Yeah, I'm also learning. Yes, Shukruti. Yeah, please tell me.
Yeah, I just want to ask, a few people say they have got frozen shoulder, but I doubt it. And how can I tell that they are telling the truth? Or sometimes people have a inactive lifestyle, so they are not active at all. And how I somehow feel that if they are active, only then this can be solved. Or maybe I'm wrong. Can you explain it?
Okay, I feel that is what we are going to do. We have to, you have to learn how to assess it.
Okay.
Whether the person, yeah,
Exactly.
exactly. That's where we are coming. The next part, you have to learn how to assess as teachers. Okay, as yourself who are suffering from frozen shoulder, you have to know whether it is actually frozen shoulder or it is just a muscle soreness or inactiveness or overusing of that muscle. Correct?
Right. I'll just
Thank you.
Yeah, I would like to ask,
Yeah.
I would like to ask something.
Please.
I'm Ritu here, Ritu.
Yeah, hi Ritu.
Hi, I wanted to ask, see, as I'm working for a bank, and I'm sitting in one position and the AC falls on that hand only. So is it due to the continuous AC falling on the same hand? Do you have frozen shoulder? Do you get that way also?
Laptop.
Okay, and you are relating to the AC, which is cooling the room.
Yeah, because the chair on which I sit, the AC falls on that hand only continuously. So is it due to that?
I get your point. Okay, as the name suggests, it could be due to certain freezing or cooling, but yes, indirectly it could be. Okay, that is one of the factors that enhance, aggravates your frozen shoulder mechanism. If you're sitting in a cold room, so your process of freezing your shoulder can be aggravated due to the environment.
Okay.
But that is not a direct cause at all. That's maybe one of the causes, but that's an indirect cause.
Okay.
Yes, Sarla.
will it happen due to the over usage of hands also? Will it happen?
Yes.
Definitely. That's what happened with my mom. Yeah. All right.
Mobbing, is it a mobbing thing if you do with a heavy mob or something?
Heavy mob.
If you do continuous mobbing.
Continuously. Suppose see, every muscle, every tissue, every organ in your body needs some rest at some point of time. So optimum amount of rest, optimum amount of your blood circulation around that tissue, always that that factor that which contributes to the frozen shoulder. So please see that, don't overuse, don't continuously do the wringing of your when you wash your clothes, don't squeeze wringing all the time, give some break in between. So continuously doing for a month or two, a particular activity in your house. I would suggest, just minimal breaks in between your activities will be the most advisable.
Yeah. During the COVID, when there is no bike in the house.
Yes, that happened only after that. Correct.
Yeah.
What I'm saying, it happened only after that.
Cool. There's a very good friend of mine, one doctor. Like they had to come back from Kokila and he had to wash his own clothes so that the children don't get affected. Every day he used to come and like he can't even use the washing machine because then it will be infected. So he had to wash it with his hands and he got frozen shoulder. The wife was saying, you went, yes, definitely.
One more thing, it happens more on the right shoulder.
Not necessarily. See, it's not a right or a left. We say it's a dominant hand. I mean, somebody has a dominant on the
Left
right.
hand.
So
Okay.
more you use, it is, I mean, most likely to happen on that side.
I am Beena Shane. It happens due to mobile holding in the hand for some time.
It could be a factor, ma'am, because see your your grip, your grip muscle, you're providing, you're having, I mean, increasing the tension on your forearm and your hands, right? So that also indirectly happen, I mean, related to the shoulder muscles as well. For
Okay.
example, your deltoid muscle, or the shoulder muscle inserts on your forearm. So forearm also related to your grip. I mean, it's near to your hands. So it's all related, ma'am. See, whenever you overuse, out of the normal, then it's likely to happen.
Okay, yeah. Thank you.
Shall we start the self-assessment? Then we'll have a Q&A again at the end of the session. Mindfulness, the asanas and the physio together. Okay, so you can keep your question ready. Even after our class is over or workshop is over, we can share it in the group so that all of us keep on learning together from your students, from our students here. Okay, so I hope you're able to see me clearly. Yeah, go on. 1 second, let me just push a little back. I will try to send you a video of these self-assessment postures so that you can keep it with you. Okay, but we will practice together right now. All right.
Right.
So we can sit in any posture. Be comfortable.
Yeah, we can facing towards the screen.
Okay, all of us facing towards the screen. I'm sitting in Vajrasana. Okay, if you're more comfortable sitting in Sukhasana, you can sit in Sukhasana also.
Yeah, we can.
All right. I'm more comfortable in Vajrasana, your choice. If anybody is like not comfortable sitting down, you can sit on a chair also.
Yeah.
No problem at all. You can sit on a chair. Yes.
So first, ideally we'll be checking our movement of the shoulder. I mean, there are, three movements of the shoulder. So that's how we, analyze ourselves. Where are the problem around our shoulders? Okay. So first, our starting position would be your palm facing your thigh.
Okay. Facing
Okay.
towards the thigh.
Or if you are sitting on, squatting, then you can just, make a fist out of your palm.
Okay.
Because that will shorten your, it won't clear the ground. So for ma'am, it's like, facing the palm towards the thigh, right? So the action is called the flexion of shoulder. So what I'm trying to do is, you just raise your arm forward until 90 degrees and raise above your head, raise until it's, at the same line with your right ear. I mean, we are doing on the right side, so I'm saying it's the right ear, okay? Right? And then gradually, see, for a patient with frozen shoulder, it would be very difficult to bring up the arm till the 90 degree, or maybe just ahead of the 90 degree. Right? This is flexion.
And let me just share someone here. That's what I'm thinking. We have someone who has the problem. And yeah, you can look at towards the wall. Yeah, see, he's not able to get it till 90 degree. His pain starts from here. He's right now in the frozen state. Frozen state. Okay. We're getting this? All right. And come back. This is how assessment one side. We'll all practice it together. All of us here.
Let's all practice together for once.
And come up very slowly, taking the affected hand in one direction front till your right hand is Parallel to your ear
Parallel to your ear.
and
No, I'm not straight.
oh, straight come back.
Front,
Okay.
yeah.
All right. Okay. I'm recording this, so we can always have this video. Then what is the second one?
Okay, the second one it's abduction. I mean shoulder abduction. The movement the movement is called shoulder abduction. What we're trying to do is face your palm right to your screen.
Okay.
Okay. Then gradually move away from your body. And after 90-degree above your head.
Okay. Same thing. In
Palm
a
facing the screen. Same thing with your hand is parallel to your ear. Fine.
Yeah.
Yes, come back to the starting position again. Then, yeah. Right.
I can see Sarla here. Okay. All right. We're getting this. The pain must be starting a little bit. One more round. Shall we practice together from the side? Teachers and all of us together. And all right. Okay. Then the third one. Okay.
Neck.
Sarla, please be there. Please be there. See, it must be hurting, barabar. And your neck start
Tilting
keep
on the left.
tilting on the left. Try to keep the neck straight if you
Straight,
can. Neck, looking, your neck starts tilting. Yes, that's it. This is the exact position, guys. Anubhav is completely healthy. No frozen shoulder. All right, come back. All right, this is how we assessed whether we got it. I hope, where is she? Tanya's question. Okay, now, next one. Shall we go
Okay,
ahead,
yeah,
everybody?
let's
This is the
complete it.
second stage. Okay, then we'll complete and we'll have the Q&A.
Q&A later.
Yeah, third one.
Okay, that's the abduction.
Okay.
First is the flexion. Now, I'll ask you to keep your arm parallel to the ground. Your arm parallel to the ground and your elbow is flexed. I mean bend. You bend your elbows.
Okay.
Okay. And your forearm. This is your forearm. This is your forearm. This also parallel to your ground. Right. This is your starting position. Now we are going to do
Like this.
yes, this is how it is. We're going to try for a shoulder external rotation and internal rotation. First, we'll do the external rotation. External rotation would be keeping your forearm, keeping your arm parallel, static, parallel to the ground, and move your forearm up gradually, parallel to your head, your ear. This is how external rotation is.
Okay.
Okay.
This
movement
and
now.
this.
Yes.
This and this. Like a
Yes.
break dance. This and this. All right. This is your
External rotation.
external rotation. Okay. External rotation.
Right.
All right.
Okay. Now we'll come back to the same starting position here.
Okay.
From here, now we'll do the internal rotation. Internal rotation is keep your arm parallel to the ground and come internal rotation. Your forearm below, parallel to your body.
First was up. Now I'm going
Now
down.
it was up, and now it's down.
It's down. First was this, and now it
Now
is
it's internal
internal.
rotation.
Here for me also, I'm having little pain here. You can see my shoulder little squeezing out.
Mhm.
Yeah.
Right, everyone?
You're getting this? Yes, Sarla, I can see. Yeah. We have Dasunil, can you keep your hand little straight? So this is an affected hand. Yeah. Elbow little higher up. Elbow, the other elbow. Okay, this is fine.
Okay.
Up, coming up.
Close the door. Close
Yeah.
the door. Close the door. Nayantara and you, Ponty. Close the door. This way.
Perfect. All right. All good till here, guys. It's very easy. Okay, here, if you want to see from a close quarter, we go up, or we go down. See my down, my shoulder starts little squeezing for me also. So my Marichasana, if you guys are here practicing with sir, my Marichasana is never complete. I was born with this shoulder. Ha. So we need to understand what are, our body type whenever we are practicing. We're getting this? Veena said it's good, both the side. Perfectly well. This is it.
Yeah,
Anything else?
This is it for the shoulder.
This is it for the shoulder. Okay.
Can we just quickly go to the center?
Yeah, let's all go quickly go together. Can we do both the hands together?
Yeah.
Okay, I'll be doing both the hands together. Okay, and let's start. All to open. Come. You can sit on a chair also. And we go slowly, as slow as possible. Nice. How much as you can for Sarla, that's Sunil, for those who are having the condition. Okay, there is no rush. And we come down the same way.
Yes,
And
same
we
way.
go back. Okay, we'll go for the side now. Palm facing towards the screen. Back. Yes. Up. And it's like Tarasana. And beautiful. Okay, the third one is,
It will be a little tough with the both arms.
okay, so I'll do with my arm, which I didn't do last time. Okay, you guys practice with any side. Okay, and we check it up. Vote for Congress. Come down. Don't vote. One more round. Come up. And second round, we go down. I think this is good.
Yes.
It's a good addition to our this thing. So one of us was asking, Sukriti, I suppose, or Vaishali, who was asking the question. I hope this is good. Yes, Sukriti. It's good enough. So you will know when someone is faking or not.
Yeah.
All right. I think these are the 4 directions of your ball and socket here. All right. Now let's go to the lower back pain. Lower back pain. I had someone with slip disc here in the class. Can you just wave the hand? Anybody with a slip disc in the class? No, she has not come. All right. Okay, no problem. Okay, we'll start. Yeah, please tell us.
So now again, we'll start with the self-assessment.
Yeah, you can say something about
Alright.
if anybody has any questions. There was few of them with low back pain.
Yeah. At the later part of this class, we'll just discuss about, briefly with the Q&A. So back normally, the causes of the back pain would be, say, the most common cause would be sciatica. If you have heard of sciatica, sciatic nerve is one nerve where we get sciatic nerve is compressed, then we call it as a sciatica. Any symptoms, any disformity, any irritation, anything which is happening due to this compression of this nerve, which is called sciatica.
So,
Right.
sorry, where is the sciatic nerve? If you can show it on our body.
Sciatic nerve. Okay, I will just turn around. Okay. So sciatic nerve normally comes out of your. Okay. Another thing is lumbar, the spine. There are three sections of spine: cervical, around your neck, then a mid back, that is the thoracic, and lumbar. So lumbar is your lower back area.
Okay.
So from the lumbar, there are 5 bones. Out of those 5 bones, which comes out the sciatic nerve and sciatic nerve. Okay.
From
Right.
the,
I'm just turning my back to you, to the screen.
okay, I can turn. You can show it. Yeah.
Come on, like,
So right, your lumbar starts right lower back, just above your hip line, right? So the sciatic nerve comes out from the lumbar, okay, goes out through, laterally, and comes down to your hip extensors. Your gluteus. Gluteus is the muscle which is helping your hip movements, right? So it supplies down, and from your behind your thigh, it branches out to numerous nerves as well. Okay, which supplies to your lower leg, toes, your foot. So sciatic nerve comes out from the lumbar area. Okay, not from here, not from cervical, but the lumbar area, lower back, right? So it comes down. I mean, there are always pair of nerves. I mean, I'm just showing towards the right. So it goes left and right. Okay, for all the nerves. Okay, left, right goes down your glute area. It doesn't supply your anterior part. Okay, sciatic nerve doesn't supply your anterior part. Any muscles of your anterior body.
Okay.
Right,
So,
everyone?
yeah, always on the posterior side.
Only on the posterior side. Right. So due to the compression of this, there's one, and another one is your curvature. Your spine has two curvature, right in the cervical area, then right in the lumbar area. They are curved. So these curves are, fixed anatomical position for every individual in this entire world. They'll have a curve. This curve is not um, the curvature is not increased, rather not reduced. Not strengthened or not increased. The curvature has to be
Fixed.
at a fixed optimal for every individual anatomical position.
Okay.
Right. So due to this curvature as well. See, if somebody has a big tummy, so the curvature will be gradually. Normally it will increase because your tummy will be pulling your anterior part of the body. So your spines tend to increase the curvature. Right. So there's another curvature. There's another very most common is degeneration. Degeneration. In the scientific term is called spondylosis. Spondylosis is the main factor of back pain, right? See, when gets degeneration, your cervical vertebra, we call it vertebra, you can call it as bone, okay, lemon. Cervical vertebra gets depletion starts, your bone get reduced into sizes. Okay, there's so many factors going on inside about the body. So due to that factors, so that affects the nerve. There is certain slight irritation to the nerve. It causes so many things. Your pain, stiffness, your all the biomechanics changes into your body when certain body or a structure changes in the body. So these are some factors for low back pain.
Okay. So to sum up,
Spondylitis,
degeneration,
curvature, degeneration,
Okay.
your sciatic nerve,
Okay.
or say sciatica, and your curvature.
Curvature. So
body
curvature is overweight or pregnancy,
pregnancy, overweight, or injury.
injury.
Yeah.
When you're putting lots of pressure on
On the back as well, or on the anterior part as well.
Okay. There was someone in our class who wanted to know about someone with a cervical problem here. Sarla has a cervical problem. Okay. She has the same with the frozen shoulder, and cervical also goes hand in hand. Yes.
Right,
Cervical.
right.
You want to ask something about the cervical? No.
Yeah, I'm having severe pain here in the neck area also, along with this frozen shoulder.
Mhm. Right. So okay, Matt. See, normally when we confront any problem in our body, so we thought that okay, that is the only area which is causing the pain. So for example, you're having pain on the shoulder. You can hear me? Can you hear me?
Yeah.
Okay. So another problem is, see, when somebody is having a frozen shoulder, it could be the origin of the pain can be from somewhere else. Like in your case, it could be the cervical is the main problem, which is causing your shoulder problem, right? So cervical nerves, which are coming from the cervical area, that might be irritated, that might be compressed, that might be anything might be happening around that area, and which is gradually radiating towards your shoulder. So diagnosis has to be really perfect regarding this, so that we can treat properly. So in your case, I would suggest your shoulder shoulder assessment properly done, and as well as cervical area as well. For that, we'll just share later on for cervical.
For cervical as well as that. So we have someone. Sushil is saying lower back becomes straight some case when in the lower back pain.
Normally, what
Yes.
happens is your
Yes,
one hand is
in that case, your curvature is reduced.
you don't use
Lower back straightening means your curvature is reduced. Your curvature is supposed to be say here, so it is straightening here. That may be the main cause of your low back. Definitely it will be a cause because your normal posture is not right.
Okay, that is due to a postural defect.
Yeah, postural is directly related.
What
to
kind of
posture.
postural defect? Matlab, you are not standing properly or sitting properly.
No, your work culture may be one. You've been sitting for a long time in a day,
Okay.
or maybe say long-standing work.
Okay.
Say you've been standing in your profession that involves all the time standing in your office or anywhere.
Okay.
So that may be the causes for that.
Okay.
Postural change.
Anubhav is saying what cervical and vertigo goes together. Vertigo.
Vertigo is okay. There are too many questions, very too many things. Okay.
Yeah.
Vertigo, I call it as vertigo. Vertigo, okay, it's okay. Vertigo is like something, you have certain headache that comes from the cervical area. It's quite related to the nerve. Okay, nerve can be from and even arteries. There are arteries which is called vertebral artery. Sometimes when you get compressed, okay, vertebral arteries will supply blood to the brain. Okay, very simple term. So that might get compressed. Okay, compression could be due to anything. Your cervical problem that creates the compression. Okay, or maybe say any disease condition that causes the compression. So that is affecting and causing the vertigo. So it can be related to musculoskeletal. It can be related to nerve. It can be related to your thing postural
Defects.
Postural defects.
Long working hours.
Long working hours.
Yeah.
And in front of your computer, in front of your mobile,
Okay.
your eyes, sight also directly affects to your cervical muscle spasm.
Okay. So I don't know about you teachers, like I have like around during this COVID, before the COVID also, there were around 7 to 8 students who were bankers. And they had this left shoulder. Is it someone is doing? Are you getting it? Bankers. Okay. Mostly with one shoulder. I have one friend who can't move. I think you're taking lots of stress along with the work. Okay. With the numbers, maybe the numbers are too important that we, what do you call, our whole attention goes to the number and then you forget your number. You're focusing on a number. All right. So mostly spondylitis with this bankers. 7, I don't know. It's like a, like a 10. You just pay attention, teachers. Yeah, exactly. Yes, Minu. Cool. Yeah, bankers. I mean, I find one side. My friend is a lefty and her all the left, this thing is like, she can't move at all the left side. All right. Okay.
Sometimes people face tingling and because of pinch of nerve, tingling in body.
Yes, definitely, ma'am. See, when we analyze, we assess the patient, first we look out for tingling and numbness. Tingling and numbness means that your nerve is affected. Simple. Tingling and numbness. Okay, there's no stiffness, contracture, spasm. Okay, leave aside. Tingling and numbness is your nerve is affected, ma'am. Simple.
Yes.
Yeah. Hi. Okay, actually, I'm also facing, exactly, I'll not say I have a frozen shoulder problem, but I think since 3 months, I have got this issue where my back, this upper back is quite painful and this shoulder area is very painful and I feel that numbness. So I can't lift bags also when I go for shopping from this hand because this area is completely painful right now. So when I was doing those exercises, so I can easily do the exercise, but I feel a lot of tingling thing over here and like numbness.
Okay. So what is this stage? You'll call it the first stage?
See, if you can do the entire range of the motion.
I can. It was painful little bit, but I could bear that pain and complete.
Okay, that is the initial stage, freezing. So it's you need to be really conscious about it, because that is the right time to interfere in your pain. It may go on, it may aggravate later. So that is the right time, that is the freezing stage, because after that your stiffness will come in. Once
Okay.
pain will be at the peak, it will be at the highest, then after that your stiffness will gradually start. So that is the right time to intervene.
Intervene, so she can do prevention with yoga asanas
Yes,
in
yes.
this at this stage. Yes, Minu, you can do the yoga
Just the
asanas
prevention, huh?
for the prevention.
Actually, I was very regular with Ajinkya's classes also. So last 2 months I have left it, and that's the time actually I think the pain has
Yes,
started also.
exactly. So it was maybe already in the initial stage, and the asanas were helping you. All right. So keep
Yes.
practicing. All right.
People can
Sukriti,
take physio at that point. People can take physiotherapy.
in
At
the
that which
initial
point?
stage.
See, you can take physiotherapy at that stage, freezing, but that has to be just the pain relief therapy. Physiotherapy will not, if any physiotherapy trying to strengthen or stretch your muscle at the time when you have this pain, severe pain. So please, that's not the right thing. They will be definitely asking you to apply ice, hot packs, and gradually, relaxation movements. Okay, not very advanced movement. So they will definitely, when you consult the physio, they will definitely do that. Pain relieving. After the pain relieves, after the pain subsides, then they'll do the other alternative.
Okay. We'll have one.
Uh,
Yes.
Sorry, one more query. You said that for bankers, the left hand issue, but how come left hand? Like I'm a right hand person
Yeah.
and
So
I have a desk job. I sit for
this is
long
what
hours.
I have
but how come
noticed. Yeah, this is what I have noticed. All of them, like around 7, 8 of them. I had written down the name also, all on the left side. The left
Yeah,
side
but
service.
I could not correlate. I sit for long hours, like 10, 12 hours I do work. But how come left hand?
So what do you really do, ma'am? You're working on the keyboards or
Yes. So a laptop working. So because of work from home, my obviously the postures aren't perfect. So like however I can manage. I have alternate week. 1 week in office, 1 week at home. So when I'm at home, that's like really horrible position I sit into. But really long hours.
Okay, see, I need to, okay, for that real assessment need to be done. But again, what my suggestion is after seeing patients, that would be definitely due to posture. So one of the shoulders is overusing or not using at all. So it has to be balanced. Okay, ma'am. So I think the concern would be, you try to balance in, all the activities to both the arms and shoulders, right? So please have a concerned thought on that. I have to do both the arms. I utilize both the arms. I have to raise both the arms at the same time, right?
Okay, so can we make this the last question? Sukriti will do it after the assessment of the low back. Okay, else we won't be able to learn. The questions we can put in the group afterwards also. Okay, we'll put in the group and we will answer each question for this one whole week. I'll keep the group alive for the whole week. Okay, and I'll share you Rinku's number also. Is it okay? All right. So low back ka, let's do the self assessment first.
Right.
Otherwise, sir aa jayega and sir will be like, kuch nahi kiya abhi tak. Cool. Yeah, let me. Low back point.
Okay. Okay.
Stand. Yeah. Okay. We are standing for the low back. I hope you're able to see me.
Because this low back self-assessment will be a little difficult with sitting position. Okay.
Side the thorax.
Side.
Side. Okay. I'll show you the side view.
Right. So see, the terminologies, flexion, abduction, extension is all the same for every, your joints, back or shoulder or anything. So I'm using the term again, flexion. So for assessing your back flexion means forward bending. Okay, this simple term. So please keep your arm on the thighs. Okay, straighten, neck straight, back straight, right? On the thigh. Gradually bring your palm sliding down on the knees, on the knees and below the knees, okay, face towards in the front, facing forward.
Okay. My face is facing forward.
Now you, I mean, bend down, I mean, neck up, looking the ground. If you can touch from right from knees till your toes, in between that, you are normal, perfectly fine. In between, if you face any problem like pain, stiffness, restriction, then there's some problem with your back. Okay, this is a lumbar flexion. Right.
Come out the same way. Yeah.
You come
We
up
are going to
same-
Uttanasana actually, or triangle pose. Okay, Trikonasana. If you are facing any kind of pain in between, then your lumbar is facing some problem. Correct?
problem. Yes. So for somebody, for gymnast or a yoga teacher or somebody, it might go down to your palm might touch the ground. Okay, that's okay. I mean that's hyper flexibility, is which is okay. And for somebody, if you cannot go beyond your knees, then there's a problem, right?
Second one.
Okay, second one would be your back extension. Okay, that was a flexion, back extension. You're turning your okay.
Like this.
Extend your neck behind and gradually bring your back towards your back, as much as you can, there without restriction. Okay, yeah, hold it back, come back to the same position again.
Okay.
Right, same. If you face any problem, there could be a problem due to back pain.
Okay.
Mhm.
I'm just opening my chest, right?
Opening your chest, and here what happened is your curvature is increasing slightly at the lumbar. Okay, and that is the extension.
Okay.
And we'll face the screen again. This is for your lateral flexion. It will be left and right.
Yeah.
So we'll do for the lateral flexion. Lateral flexion is first we try on ourselves on the left side of ourselves. Okay.
Okay.
So we'll just go, I mean, palms touching the thigh, facing the thigh, gradually go down your palm, slide down, 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 even your neck also going down. Try to touch the knee by your palm. Okay. Then come back. You have to touch the knee. That's the normal position,
Okay.
the normal range of
So, sorry. What about the distance between the 2 feet?
Okay, sorry. The heels are touching each other
Okay.
and your toes slightly apart.
Okay, like a V.
Like a V.
Like a capital V. Okay. Yeah. If you want to see like a capital V. Let's do the other side then. Right hand.
Then we'll go to the right. Touching the knee.
Okay.
Then come back to the starting position.
Yeah. So we'll practice one more round again, all of us. Okay. I'm keeping my hands on the thigh, and all of us inhaling in the center, exhaling, we go down to. Teachers will understand it's like the Trikonasana. Slowly, as slow as possible. Correct, Indu?
Yes. Can touch the toes if you can.
Right.
That's a flexion.
And
This is extension.
extension.
Right.
Coming back in the center. I hope I'm not going too fast. Both the feet in V. And then back. And so these are the 3 self-assessing for your low back. All right. That's so we will now it's 9 o'clock, is it? the
Yeah,
time.
nice.
So 9 to 9:30, 9:45. First, shall we go ahead with the yoga asanas? Anybody wants to take a small break? Or shall we go ahead with the yoga asanas? Yes, Apurva.
Ma'am, just a small doubt. While bending forward in Trikonasana, the first thing, I did not feel it on my lower back. I felt it more on my right hamstring. So that connects to the back issue only, or it is something else?
Okay, okay, you're going down forward.
So she's feeling on the
Yeah.
hamstring.
So when I'm bending forward, I'm
Uh-huh.
feeling it here. I'm feeling it, the pain a little more only on the right side, not on the left.
So I feel, may I take this question?
Yeah,
Yeah. So whenever we're going in the forward bending, we learn forward bending and back bending class, like hip opening and all. So whenever we are going in the forward bending, our spine is stretching and the
Glutes and
the
hamstrings.
glutes and the hamstrings are working. So that's a
Yes.
one. It's not harmful. That means
Okay.
your hamstring is working at that moment and trying to flex. Correct? Okay. So which is the opposite whenever we go back? It's compressed.
Mhm.
Okay.
So whenever we are doing the back, it is the quads and the intercostal muscle which is opening. So whenever we are doing forward bending, any forward bending, our hamstring, which includes the calf also, okay, it is like extending or flexing.
Mhm.
Extending.
As long as you're keeping your knee straight, not bending, that's the right posture for back flexion, bending. I mean flexion of your lumbar spine. That's the correct posture. You should not bend your knees. You should not bend your hips while doing your back flexion. Right.
Yeah, my knees are like have been straight while I was doing so.
All
Okay.
right.
Thank you.
Thank you. Anybody else has any question? Yes, Sarla. Sarla, you're muted. Yeah.
While doing this, severe pain is there.
Yeah, your neck will be arching. So for Sarla, for you, I would suggest keep looking in front.
Okay.
Don't squeeze the neck. Keep looking in front.
Okay.
Yeah, that will help you. And try to pull the shoulder down. Don't squeeze the shoulder up and go how much as you can looking in front, not looking up or not looking at the back. If we are looking at the back, naturally there is compression and yours is already compressed from before. All good? Yes, Pinky. You're good. Healthy. All right. Sushil, is there any question from Sushil and Anubhav? All good? Yes, Anubhav.
Okay, so I primarily joined because of the lower back pain, and it has been, hi.
Yeah.
So the problem was that I had an early injury because of sudden lifting, and that was a long time ago.
Mhm.
So I tried to pull something up, and it was winters, and it's a long story. But yeah, what happened is after that I had a very severe back pain. I could not move for 15 days or so. I just could not move. Now on and off, this happens again sometimes. I do a bit of gymming, but it's not because of that. But some careless bend or something, it happens and then it pains. Like right now, on the right hip joint, there is a pain, but it can be right or left. It's not constant. It could be either side. So that's why when I bend forward, the movement is full, but there's a pain on the right side of that is the right point on the back, lower back. And when I'm doing the side flex, of course, that same side.
Mhm.
I went to a physiotherapist here. I did, and so what he told me is it has to do with something. It's not actually a slip disc, but something very similar when it slightly moves. So he told me do Bhujangasana, just
Yes.
flex, and it
Okay.
helps me. It does help. It makes it better. But then it's happening very often. That is the biggest problem, and I can't exercise, and I don't like it. So.
Okay. All right. Okay. Have you done any X-rays or anything?
Yeah. We did, I think. Yeah. Yes. We have done X-rays. Yeah. There is no problem with the spine.
There's no problem with the spine at all. Okay.
Uh,
Only X-ray or CTs or MRI or anything? Because there are two different things. I mean.
yeah. I know, but not recently. But when I had that injury, I got it done.
Uh-huh.
Not recently.
Not recently. That time you didn't find anything.
No. But that was many years back. Almost 15 years. 15 years back.
15 years back. Okay. This is having. Recently, this is problem started again.
Yeah, it happens on and off. if I'm careless while exercising, sometimes I can just, it's like I can pull a catch kind of a thing. But it's not a muscular thing. It has to do something with the spine, I think. So,
Yeah, most probably. Okay, so yeah, we would suggest for the time being. I mean, whatever has been, whatever has been relieving your pain, whatever activities, okay, you increase doing that. Whatever is restricting, you please, keep it aside for some time. Okay, as long as, and one more thing, lifting heavier objects. Okay, it's not necessarily very heavy, or you according to your limit of your strength, right? So avoid that, and when it is required, you do it from the side, not front. Whenever
you
you're
don't lift-
lifting anything by your single arm or double both arms, don't do it from the front. Okay, I mean that aggravates your compression or whatever it is inside. There might be your disc. People call it as a slip disc. Disc comes out of your this spine. I mean, but vertebra, your alignment of the vertebrae comes out, and
that's what he said. Probably that is what is happening. And when it moves, it compresses the nerve, and then the pain.
yeah, impinges the nerve. Right, that may be a problem because I cannot tell you right now. Okay, exact cause. So please, as far as I understand, it's aggravating by certain acts. So please don't avoid picking up, okay, heavy objects from your front. From your front. Always do it from the side.
Okay, so avoid picking up like this and just to pick up from the side like this.
See, for example, see, picking up things. Okay, this is avoid thing. Do it from here. Okay.
Okay.
Right.
And maybe you can share us your X-rays or something if you want to go for a second after the class.
Maybe what I'll do is I'll get it done again just in case. See, the problem is when I'm fine, I'm absolutely okay. There is no problem at all. I can do all the exercises, everything. But when this moves or whatever happens, it actually this prevents the pain for initial 2-3 days is very 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 high. It's I'm not able to
Move
do
it.
even normal work. Yes.
Okay. So
All right. One more thing. Just
yeah.
add to that. Okay. See, people, they advise you for belt and lumbar belt, whatever. So what I want to suggest that, but do it if you have one. Do it when you're climbing upstairs and climbing down. Okay.
Wearing the belt.
Wearing the belt. I mean, yeah, wearing the harness or belt. Okay. Anything which is you can tie dupatta or something. Okay. Just climbing up and downstairs. Okay. So any other activities you can do without it.
Yeah, that is one of the most painful things to do when it actually happens, to climb up or down.
So you're suggesting him to put a belt or something
Put a
around the
belt
waist.
around your waist. I mean your lumbar area, lumbar spinal
And long periods of standing. My job requires sometimes that I have to keep standing for a long time, and that aggravates the thing.
The only thing I would suggest is just
Take a small
breaks to sit down.
That is what comes with the mindfulness class. Okay, we had the workshop last. Yeah, that's not also there.
My job is such that there isn't enough place in the aircraft, so I have to stand for a long time. So.
All mindfulness. You have to keep coming back to yourself, and you have to remind yourself that is the only way out. There were like 10 participants last workshop last Sunday, out of which 9 were like women. Okay, and all those women were like fantastic, working successful in their this thing. One was an actor, one was a businesswoman, one was like some government handloom, something like
chairman.
Chairperson. Okay, chairperson. All of them were like so hyper. It was so hard for me to tell them to put off the mobile phone during the class. Yeah, the best part was they came for the class. That is one first step, okay, to our dharma, the duty. Like, they all came for the class and they were struggling with their habits. Okay, so they say that it takes 21 days to get rid of a habit. Okay, so all of this, it will come with practice. You know that you're giving your own answer. You know that Bhujangasana helps you. So you have to do Bhujangasana every day. Okay. So every day, it is not like when the pain comes, then I take the painkiller. Okay, so yoga asanas, what we will be doing right now is all prevention or complementary to our muscles.
Thank you.
Yeah, thank you, Anubhav. You can always send us and contact, okay, whenever you want a second option. Guys, shall we start with our practice? What's the time? Perfect. All right. Is there anybody in the class who find it difficult to sit down? And I'm sure like all of us are sitting down. Sushil is sitting down. I can see all of you sitting down. Okay, we are not going to do heavy duty our 9 o'clock, 6 o'clock or for others this thing practice. We are just going to learn few stretches. Okay. So if possible, let's stand up. Okay, if anybody finds it difficult, you can always sit down, and I'll keep a record of this. But these are all something which we always practice in the AMY class. So those who have been practicing with us, which most of us are, you'll find it very easy. All right. Okay, let me just. All right. We will start with the frozen shoulder. We will not forget Sarla, Dasunil. All right. Fit. Okay. Always you can keep the feet together, or you can have little space between the two feet. You want to use the mat? You can use the mat. Okay, little fit. All right. Interlock your hands in front. Okay, and we pull it out. These are simple stretches. This much I'll send you the video. Okay, and we turn it out from the side. We are not taking it up as yet. Okay, stretching. Stretch as if you want to touch the screen. How much as you can. If you are facing pain in this, you relax and turn it out. We're getting, this is always our warm-up in our AMY class. Come back in the center again. One more round. I turn it out. And I turn it out. That's correct. Sushil, that's correct. All right. We're getting this. And I pull up out again. And take it up above my head. And pull it up as if stretch from the side of your body. My legs are full. Observe your breath always when you're doing physio, when you're doing your yoga asana. It should be very comfortable right now. How I'm speaking to you, you should not be breathless. And come down. Easy, very easy. We were just trying to practice. It's the same thing. How we were doing this, we are just trying to improve that movement in the form of stretches. Barabar? Interlock the hand one more round together. I pull it out. We turn it out together with a gentle smile on the face. Take it up. Always relax your face. Mind totally calm. Pull it up, up towards the sky. Observe your breath. And come down. Okay, all of you can be standing or you can come near the. Okay, I go in Namaste. Okay, I'm doing Namaste with my palms here. Okay, all good. And turn your Namaste. You turn your Namaste. My right palm, I interlock with my left. Okay, and take it out. How much as you can. If it is difficult, Sarla completely, okay? Come back. And we go out. Again, 2. Easy. From the side. We go out. Again, 3. Very simple. And we come back. Okay, we come back to our Ulta Namaste. I take my right hand and left hand, sorry, and I join with my right. Okay, some of you, shoulder will be up. Try to keep the shoulder down. And we go out, 1, and come back. Observe your breath. That's how much as you can. Come out, 2. Do not put so much of effort. Just check how much it comes effortlessly. And 3. This is working on your tricep. This is working on the ball socket here and a little part of your biceps. We're getting this? All good till here? Shall we practice one more round? Okay. Don't worry, don't even try to write down. I will share this many compressed form of asanas in our group so that you can practice baad mein. But don't forget to practice. Okay, hands in Namaste. And we turn. Right hand say left interlock. And we go out. 1. Come back. And we go out. 2. Effortlessly. And come back. Apurva, you can see me. We go out. 3. And come back. Beautiful. Shall we change? I change. Interlock. We go out. 1. And come back. We go out. 2. Second round must be a little easier for all of us. We go out. 3. And relax. Very nice. Okay. The next one, which we always practice before our handstand class, Eva, handstand class, okay, or before we do any practice, handstand, headstand, where we do warm up our arms, okay. I take my right hand up, all of us, okay. My right palm facing outside, okay. My left hand will catch the elbow, okay. Can you see this? And I'm pushing my right palm away from me. What's happening? My left armpit is opening. Close your eyes and feel what's happening on the left side of your hand. And don't push forcefully. How much your breath allows, that much. And come back and relax. Thoda samajh mein aaya? We'll repeat one more round. Let's do with the left hand. I take my left hand up. I turn my left palm out. With my right hand, I catch my left elbow from the back. And I take my palm away from the... You focus on the right armpit and the right tricep. And come back and relax. Okay, there was a question. Let me just check. Everybody will get this. The stretch is very painful for the left shoulder opening. Minu, you will avoid this, okay? Because that's the affected one. So you will avoid it, and we will give you an alternate to this. At the end of this session, there will be 3 to 4 stretches which you will be able to practice on the affected area, both for frozen as well as the low back. Wherever it is painful, please stop. Don't fight with the body. The body is your friend, all right? We'll practice again. Come, right hand up. And right palm turn out. With my left hand, I catch my right elbow and I go my palm down, away. It looks something like this from the side. I come back and take the left hand up, turn the left palm out and go. We're getting this. Open the right armpit and relax. We're getting this. Simple. There was another question. Let me check. Shoulder should be pulled down. Pull away. Sukriti, pull away. Not, yeah, pull down, but rather pull away from your body. Okay. All right. All the traditional yoga asanas, like your Garuda asana. Okay, so Garudasana will do only with the hands, okay? Garudasana, your Gomukha, these are like beautiful postures to avoid or prevent frozen shoulder. Okay, let's practice one Garudasana as a rehearsal. Okay, revise, take both the hands out. Okay, we will not do the leg, we will do just the hand. Okay, I take my right hand up and my left hand is down and intertwine. How much as you can. You're getting this? Don't take the hand towards your face. Okay? You can do standing, sitting. Just take it up towards the sky. How much as you can. Sarla, Dasunil, Minu. You'll be hurting a little bit. Ritu. Jahan tak ja sakte hai, wahan tak jana hai. Wherever it is stuck and the pain starts, stop and come out. And relax. Okay, you can give yourself a little gentle hug. Okay, always. One more round. Okay, for the left side, both the hands out. My left hand is up, right hand is down, and intertwine. Beautiful. Okay, and I'll keep on Eva will be, Eva, pull it up. Don't nice. Okay, she's looking front. She's not lifting her neck up. Okay, as much as you can. This is a very free. Eva has got a very good back bend shoulders. So this is a free shoulder. All right, and come back and relax. Very nice, Pinky. And easy. We're getting one more round. Shall we practice of Garuda Asana? Last time. Okay, both hands out. Right hand up and left hand down. And we go up. How much as you can? 5 to 10 seconds. And come out. And relax. The other side, both the hands out, left hand up, and we go. And go up, 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 how much as you can, without squeezing your neck, Sarla. And we come back. And relax. Easy, you'll feel a little lighter on the shoulder. It's same like those who were in the back bend class, when we are doing the stretches on the chair, and after that you do your cat cow, how light it becomes, same like that with your shoulder. Okay, so after that you can always give little bit hug. Okay, if there is anybody who is from the Yoga Institute in this class, we have one teacher. His name is Mohan sir. Okay, I think Bina, you're there. Mohan sir, he's a Sadajin, very cute, very nice teacher. And so very low voice, and I'm someone who talks very loud. Okay, so he'll be like, after this, just say, hug yourself and say, I love Mohan. Okay, his name was Mohan sir. You're supposed to say like, I love Preeti if I'm doing it. So I thought I'm supposed to say I love Mohan. Okay, so I did it. I said I love Mohan in the class, and everybody calls me Preeti loves Mohan till now. But this is very good. Self love, coming back, Anubhav, always. This is a good way to come back and just if you remember in this class, Gyani Jail Singh, our president, okay, he had come to the Yoga Institute once before maybe we were born also. So he is like, I'm not a yoga practitioner. I don't do yoga or anything like that. But one thing which I do early in the morning is when I go to take bath, okay, I talk to myself. Okay, I talk to my small fingers. I talk to my shoulders, I talk to each part of my body, and I say hello to that part. Okay, so we need to connect with each part of ourselves so that you know what is going on, so you don't fight and push it out. Okay, so that is what our teachers always shared with us, so you talk to yourself, your toes, your lower back, your neck, your spine, and it is going to help us. All right, sir is here. Good morning, sir. Cool, everybody was waiting for you. Say hi.
Good morning. Good morning, Preeti.
Yes.
There was a class in the morning, so I was just busy with that.
All right.
Namaste, everyone.
Okay. So we are right now, sir, we are doing our asanas. We have done the self-assessment, and we'll do the asanas for another 15 minutes.
Okay.
And we can go with the mindfulness.
Sure.
Some stretches we'll be sharing with all of them in the group also.
Okay.
Okay, sir. I'll continue then.
Yeah.
All right, guys. So this is one. Now, when you want to keep your hands, again, there is one way, Gomukhasana. Okay, so I can towel. So these are all practices which we will be doing during the prevention as well as during the recovery. What Rinku had said during the thawing time. Okay, when the pain is there, stiffness is there, you are not supposed to practice. Okay, so I take my right hand up. We'll do sitting down, or you will do standing up, or you can do it sitting on the chair. Okay, and I drop this. This left hand is going to go up. Okay, if suppose you are not able to touch, okay, don't push or pull. I'm going to use that small without stiffening. The neck will not stretch up. It will be always parallel and go. Okay. Yes, Sarla. Sarla, chin little up. We have Sarla here. There you go. Easy. And take care of your breath. Okay. Stay for 5 to 7 counts here. Very nice. Eva, I'll show Eva from the back. Okay, fantastic. And change the hand. The other side, left hand up and right. This is a non-affected hand. All right, very nice Anubhav. Shoulder to ball attack. No problem with the shoulders at all. Okay, then we have, so Sarla, you can always use a dupatta. Dasunil can always use a dupatta or a small yes. And go. All right, Eva, thank you. And go back. Easy. Sukriti is okay? All right. We come back in the position. So, all right. Okay, now for the frozen, this much we can practice during for prevention and as well as something to what you call during the recovery time. Sarla. Recovery time is after your stiffness subside, the third part of your frozen shoulder. Now, Rinku will share something which you can practice during the problem. Okay, during the frozen problem. During that second part. Okay. Okay. I hope you're able to see him clearly. You can use the wall also. I can always yes.
Shoulder and back.
First the shoulder and then the back. Okay.
Right. Everyone see. We've discussed about the problem. Now we'll just discuss about the solution, which is we'll just start our therapy. Self-therapy at the second stage, which is the frozen stage. Okay. The pain will go gradually. Then you can do your self-stretching exercises, which would be, there are 2 to 3 self-stretching exercises which you can do.
You want the wall?
First, yeah.
Okay.
First I'll just go.
Yeah, we can see you. Perfect. Yeah.
Okay. Now we face the wall. Just a normal position. Then your this is first of all, this is called fingertips climbing. Okay, climbing the wall. Okay, this is for, so let's consider my right shoulder is affected from the frozen shoulder. So what I'm trying to do is I'll just keep my 2 fingers, which is index and middle finger here. Okay, facing the wall, facing the wall. Then gradually climbing up the wall with the 2 fingers. Right. This is how it goes. Okay. Okay. When you the stretch is at the maximum, then you slightly put some pressure on the palm and gradually,
take the forehead.
Take the forehead towards the wall. Okay. Give it a slightly jerk. Okay. Then come back 1, 2, 3, 4, 5, 6, gradually, slowly. Okay. This is, you see very normally, but in the patients with frozen shoulder, they won't be able to raise right from your shoulder level.
Sarla, you can try. You can try and check if you're able to practice.
You can try.
Yeah. With the affected hand. Okay. We have Dasunil, can you just show us with the affected hand? One second. Yeah. Okay. Nice. I think it is better than last Sunday. Definitely
Yes.
better than last Sunday. It's been a week he has been doing it. And yeah. All right.
Right.
Yes, of
That
course.
was the fingertip climbing.
Okay.
Another one would be, I will just need a chair or a table, just about your waist length, waist height.
Okay.
Okay. Now, and this stretching is called pendulum movement, right? So again, my right shoulder is affected. So what I'm trying to do is put your opposite hand on the table. Okay, on the table here.
It's yeah.
And we slightly bend at your lower back. Okay, release your affected arm. Release. I mean, don't hold it back. Okay, release completely. Relax. Relax. Okay, just swing. Okay, this is my swinging. Right. So now the first would be you do the flexion, that is front and back. Okay, front and back. Swing, swing, swing. Okay, the gravity. Let the gravity do the work. Okay, swing, swing. You give a slight push at the end range. Okay, that is the front and back. Now on the same pendulum technique, you can do this after front and back. Okay, this do it for say 20 to 30 seconds, and say for 20 to 40 seconds twice daily.
Twice daily.
Twice daily.
Okay.
This one, front and back. Now I'll do rotation movement. Okay, as if you're drawing, a picture. I mean, circle on the wall, on the ground. Okay, do it clockwise. Clockwise. Let the gravity do the work. Okay. Do it 30 to 40 seconds, and come to the reverse, anti-clockwise. Okay. You just need to give a slight push. That's all. Okay. And little advance in this circular motion, you just hold a little heavier object, like say 1 to 2 kgs of say weight or anything.
Okay. You can
I'll just take this one. Okay. This is a 1 kg weight. So that what happens is here that stretch the shoulder little slightly more. Okay, so that you get the pressure. I mean, pull this shoulder slightly more, and the stretching is enhanced with this weight. Okay. Okay. You can increase the circle or say diameter. Okay, gradually, and come back anti-clockwise. Okay. This is the second technique for stretching.
Okay.
The shoulder. The last one, quickly. I'll just you can do it with the sitting position here. Yeah. Okay, keep your arm parallel to the ground, flex at the elbow in this position. Okay. From here, my right arm is the affected arm. From here, trying to touch the opposite arm, opposite shoulder. My right hand is trying to touch the opposite shoulder. Touching. Once you touch the shoulder of the opposite side, with the opposite hand, which is unaffected hand, which is we don't have frozen shoulder on this hand, okay, on the shoulder. Press on the elbow and give slight pressure. Push the affected side, that is the right. Push the right elbow, and with the right hand trying to touch the shoulder blade behind. Okay, okay. Yeah, I'll just show it from the back again. See, this is my starting position. Okay, now I'm touching the opposite shoulder. Can you see my hand? Now from the unaffected hand, I'm pushing the elbow and coming back and touching the shoulder blade of the opposite shoulder. Hold it there for say 5 seconds and release. Gradually release. Right? So that's the shoulder stretching.
Okay.
There are 3 techniques. So if anybody has a doubt, come back on the group again.
Yeah, sure. So I think in this group, Ripu, one question, we have Sarla here, Sunil here, we had Minu. All of them can practice this right now?
Yeah, we can just have once and try it once.
They were practicing anyway. Yeah.
Okay.
So Sarla, those with the affected hand, the banker with the left hand, you can practice right now during the time when it is you are suffering also. Okay, during the, yes, Minu, we have Minu here. During the Frozen time.
During the
Frozen time. You can practice it very safely, Minu. But for Minu, I feel that it is the initial stage, so you can do the other asanas also.
I don't, that's why I said I don't have a lot of problem, but this left shoulder is the affected one,
Yeah.
but not aggravate problem
Okay.
right now.
So all these three postures will not aggravate, but it will help,
It will
right?
help.
It will help you. All
It,
right.
it will increase the blood circulation to your affected shoulder.
Okay. Okay. Is there any questions here, guys, of these three postures? Yes, sir.
While pulling down, I'm able to hold like this, but pain is there. But pulling, you told not to give some pressure,
Yes, yes, ma'am.
but giving some pressure, severe pain.
Severe pain. See, when the pain allows you to do up till that range, just do it. Just don't go beyond that. Right? And I think for you, just without giving the pressure, just touching the opposite shoulder would be fine.
Yeah.
Please, you can touch the opposite shoulder.
I'm
no
able to.
pressure, no pressure from me.
I'm able to, but if I'm lifting this up and pulling down, this has to be kept like this, no?
Yes,
And
yes.
pulling down, pain.
It's hurting. It's hurting.
Yeah.
Okay, okay. Ma'am, you just touch the opposite shoulder and hold it here. Hold it by your opposite hand here, right? Hold it. Don't, no pressure. Right? Keep it, keep it there for 30 to 40 seconds. That's it.
All right.
Preeti ji, can I speak for 1 minute?
Yes, Bina. Please, last question. Yes.
I have one question.
Yes, Bina.
With this exercise, people can get muscles strengthening to their muscles, so they can keep the things with easily with their hands. With this exercise, sometimes with frozen shoulder and spondylitis, people cannot take the things easily.
With this muscle will improve the
Muscle
muscle.
strengthening.
I will let you know, stretching, whatever we are doing is stretching. Okay, this is not strengthening, it's strengthening.
Yeah.
Strengthening comes after stretching, when pain and stiffness, everything goes away. We'll come back to, we'll try to bring the shoulder muscles back to their normal strength. That there you require the strengthening. These are all stretching, right, ma'am? This won't strengthen your muscle.
Thank you. Yeah.
Okay.
Sure.
Okay. That's the later part of your
practice. After you recover, fully recover, then we work on the strengthening. Okay. All right. So we have known the causes for the low back pain. And now we will do little yoga asanas for the low back pain, and then those two postures which you can do during the practice. This will be for Anubhav, okay, which I think most of them you will be knowing. Okay, it's our Bhujangasana, cat cow, all right, but still we'll practice in the class, all of us together, one more round. Okay, for that you'll have to come down on the mat. If suppose anybody is here in the class who cannot practice on the mat, please let me know, so we will give you the chair version. Okay. I think all of us, we are able to. For teachers, we all know what is the chair version. Okay, let's all start with the cat pose. Okay, we are on our all four. Okay, most important, we were just discussing before the class, is like spreading the arms, palms nicely, using the full palms, not only the wrist. My shoulder, elbow, and the wrist in one line. My two knees are as wide as the hip. Okay, you can point your toes out if permit. If else, if you're more comfortable curling in, you can curl. Today I'm going to point it out. And my hands and my two legs, I'm not going to move. I'm going to move only my spine with my breath. All right. So we inhale. I push the lumbar down and look in front. Tada will look in front. Okay, Dasunil will look in front. Those who are okay can look up or look in between your two eyebrows. Press the palm nicely and pull the shoulder blades up. Someone will gently punch you in your belly. Pull the belly slightly up without holding the breath. We are exhaling here. Together, inhale, Push the lower back in, looking in between your two eyebrows, in front or up. Exhale, press your palm, pull the shoulder blades up. 3 more rounds together. Push the lower back in, looking in between your two eyebrows. We come back up, press the palm, pull the shoulder blades up. Last 2 rounds together. Inhale, push the lower back in, looking in between your two eyebrows. We come back up, pull up, touch the chin to the chest. Last 1 round, push the lower back in, looking in between your two eyebrows. We come back up, pull up, touch the chin, and gently come back. We're getting this? So, as we mentioned the causes, if your curvature is shorter or if your curvature was lengthened, what Rinku had mentioned in the beginning, like when you gain weight or you're standing for a long time during the day practice, or any kind of low back point, this is a good posture, safe, and you can practice very nicely. Now, when you are getting sciatic nerve, okay, so we have one full AMI sequence only for sciatica. We keep on practicing it as a beautiful sequence. Okay, guys, you must learn it. Okay, but if you have severe pain and you want to work on your sciatic nerve, there is a sciatica pain. Very safe one is we will all get our dupatta. Okay, I'll just get my dupatta. If you have a yoga belt, you can get a yoga belt. Okay, very simple, very, very simple. Okay, we'll lie down on the floor. I'll show you first, then we'll practice together. Sciatic nerve to the top. And I lie down very gently. One of my left leg here, I'm stretching out. One leg is bent. This is the first option. And I keep my foot on the dupatta. Okay, foot on the dupatta. And you can either start bending with the neck or with the straight leg. And I pull the leg up. This again to flex that same nerve which he introduced in the beginning. My shoulder will be relaxed. My elbow will be on the ground. All right. And I will just, with your inhale and exhale, with your breath in work, you just make your hamstring open here. Okay. 5 to 10 seconds or 15 seconds you can practice with both the legs. And come back. Okay, if the pain is severe, you keep the leg bent. Let's try with the other side. I bend this leg and with the other side, okay, I keep my foot, the dupatta or the belt under my leg and lift it up. Am I correct? Going in the track? Yes. For the lower back, shoulder down, and we go up. All right. Observe your breath. Okay. Okay. All right. Very safely, teachers, you can give this to your student. Okay. The one with the low back pain and sciatic nerve. And someone with a little better, like, you know, if you can do it without the legs bent, you can keep both the legs straight and then lift only one leg. Working with the flexors as well. We're here. Okay, so you will not do this. You will not squeeze. Okay, my shoulders are totally relaxed. My elbows are down. And I'm just pulling as much as I can. You don't need to take it all the way up. If it is for some of us, it will be here. It's completely okay. How much your breath allows. Okay, where your mindfulness and the pranayama is going to help you. Okay, no pushing, no pulling. All right, and come back. Same thing, shall we practice all of us with the other leg? Okay, Anubhav, yeah, this is something which you can practice every day, every single day, without fail. Shoulder relax. Looking up at the sky or the ceiling or at the toe. Wherever your neck is happy. And you're right? Okay. all right, all of us. We get this. As gentle as possible, okay, no hurry, okay. Always keep listening to yourself when you have a certain condition, and the body will tell you exact point where it is hurting. We're getting now the bridge pose, and before we go to the cobra pose, we'll first practice the bridge pose as we are lying down, okay. We're here, lying down. My feet, okay, is distance between the 2 feet is as wide as your hip, okay, and the 2 feet preferably keep parallel to each other. Sometimes when the pain is like too much, you might want to take it out a little bit, but preferably parallel to each other, okay. Before you just push the hip up, mindless, like, without just mechanically, you just understand, I pull my belly slightly in, okay, suck your belly slightly in to activate the front part of the thighs, your quads, okay. You take a deep breath, inhaling, pulling the belly in, and exhale, push it back, much as you can. I'm able to do it, my lower back is not affected. For those who are affected, might be till here. Much as you can. With every inhale and exhale, with every set of breath, you go as high as possible without squeezing your neck. Sarla, take care of your neck. Don't take the chin to the chest. The chest is coming to the chin, but your chin is going away from the chest. That will keep your neck very relaxed. Do not forget your neck while you're working on the lower back. It's a part of the same spine. And gently come down. Okay, so we will use the muscle of our quads and the muscle of our chest, that is the intercostal muscle as well, to open the lower back. One more round. Pull the belly slightly in. Inhale, take a deep breath, and exhale. Wherever you have reached, don't come down. Wahan se take a deep breath, create a space in your lung, and exhale. Pull it up. Inhale. If you're stuck wherever you are, be there. 3. Inhale. Take a deep breath. Exhale. 4. Don't turn your neck left and right. Just follow the instruction. And last time, gently come down. And make both the legs straight and relax. Okay, this is also something very, very practical, very easy to practice. A part of your pulling down or warm up, you can, make it a part of your practice every single day. All right. Now your Bhujangasana. Okay. Now the Bhujangasana is something which people with the frozen shoulder, okay, when you're recovering or you want to prevent, you can practice. Okay, Meena can practice. All of us can practice rather. We'll give you 2 options. Okay. So, like even my back is a very tight, shoulder tight back. I have to do my stretching really well before every practice. All right. Okay. So I'm like lying down on my belly, on my elbows up. Okay, this is a good way to start. Okay, good technique, and I keep my palms out. Okay. My foot at the back, press down as if someone is standing here. All right, don't lift the leg up. Okay, garden pose. Correct. Perfectly. All right, we're here and press the palm. Again, you're using the muscle of your hand, and you inhale, lift the chest up and go. There you go. So Anubhav, don't take the chin up. Keep your chin parallel to the ground. Don't squeeze the shoulder up. Always pull the shoulder down and lift the chest up. Okay, this, not this, but this. Okay. It took me a long time to learn this. So Anubhav, here, try to make your hands straight. Yes. Okay. If you are comfortable, guys, you can keep your palms little thin and lift the chest up. If you find lots of pressure, you can stay like this also. On the elbows. We're getting this. You can, from a little side view, we were like this, little ahead or little back, shoulder not shrug, pull down, lifting the chest up, chin parallel to the ground. One of the best. Mostly due to the position problem, okay, this Bhujangasana is one of the best. Cobra is supposed to have the best back in the industry. And come down, all right? We'll practice together. When I'm counting till 5, if any of you feel lots of pressure on the lower back, you can come down on your elbows, but don't give up, okay? Come up, okay? Pull the shoulder down, lift the chest up. Inhale, take a deep breath gently. Exhale, lift the chest up. There you go. Take care of your neck. Inhale, press the palm. Exhale, lift the chest up. Keep your mind very calm. Gentle smile on your face. Inhale, take a deep breath. Exhale, 3, stay there. If your elbows are hurting, you can always come down. Okay, inhale, take a deep breath. Exhale. 2 more rounds, hang in there. Inhale, take a deep breath. Exhale. Take a deep breath and exhale. 5. Gently come down and you can relax in Makarasana. Okay, Makarasana is your go back posture. Okay, we are here. Cheek on the one side. Try not to close your eyes. Toes are touching each other. Heels away from each other. And come back. One very nice way for both the frozen shoulder and lower back is from here. We come back and go to your Balak Asana, the child's pose. And come back. You're getting this? Any question here? For regular practice, our teachers, you will not have much, but yeah. Anubhav, was it all doable? All doable, fantastic. I think the back is just a little, what you call, pinch or something left. So regular practice of all this should do the work. Little twisting more, which actually Rinku will be putting in his this thing. So I'm skipping that part. I don't want to repeat more, okay? And we will keep the group alive for a week and then we will discuss, keep shooting some questions if you can't complete it today also. All right, okay. So, yeah, you want to say something? All right. Now, we have little one very important, which he will be practicing as well as one of my favorite part. Why favorite? Because it helped me a lot, okay? Twisting of the spine always helped me with my lower back, okay? It's like the spine, it's like what you call, for me personally, I feel that's a kind of detoxification. Okay, when there were lots of stress on the back, the twisting always helped me. There are many twistings. We can go on for hours, but very simple twisting, which the teachers, traditional classical yoga mein, Supta Vakrasana is one of the most effective posture, which we must remember to practice almost every day. I'll share that with you. All right. Last workshop mein bhi kya ho gaya? I started talking and I forgot the time and the other teachers didn't have time to talk. So I don't want to do that. All right. We lie down. Okay. So my hands, okay, is either in T, okay, or I keep my hands under my head if you don't have space. As we all are practicing at home, let's keep it in T. Okay. And my feet is touching to each other. My knees are touching each other. Gently, I drop both the legs on the right side. But the most important part here is keeping both the shoulders on the ground. And I'm looking at my left side. Okay, it's all right if your knees are not touching the ground, but it is not all right if your shoulders are coming up. Okay, shoulder relax, then twist as much as you can. Stay there. 5, 4, 3, 2, and we come back up. This will work with the glute muscle as well. And drop on the other side and twist on the opposite side, knee on knee, heel on heel, shoulder on the ground. I'm looking at the opposite side. And come back in the center. We are okay till here? Okay, it's easy. All of us, you must be knowing this. Now in the second round, I take my right foot on my left knee. in a figure of 4. Okay, right foot on my left knee in a figure of 4. Okay, another stretch we will be sharing. This one I will just share it with you guys, and drop both the legs on the right side, as if my right foot is pushing the left knee down. How much as you can. Again, the shoulders on the ground, and I'm looking at my opposite left side. 5, 4, 3, 2, 1. Come back up, and I change. Left foot on the right knee, and drop both the legs on the left side. My left foot is on the right knee, and twist. And come back up, drop both the legs, pull yourself in, just, yes. Press your tailbone on the ground, shoulder relax, not squeeze, and come. All right, so these 5 postures you can practice very gently, okay, every day. I'm sure all of you are like already practicing. This is what you can share with your students too. All right, now when the pain is there, when it is not subsiding, what are the postures you can practice? Okay, so as we had shared that sciatica, all right, slip disc, degeneration of muscles, okay, obesity, okay, that will change the curvature, long standing or sitting working hours, okay, these are mostly the common accident, okay, unfortunate accidents, okay, these are the point of triggering the low back point. All right, and all of us identify those who are suffering with one of these most commonly. Okay, so Rinku, will you share it with us? What are the 3 interview? Okay, yeah. Okay, what is the first one?
Need your help.
Figure of 4 1.
Figure of 4. Yeah.
All right.
Figure of 4.
Okay, this is again.
Yeah,
Again, the figure of 4, like
Yeah.
how we were like this. Okay, right now, figure of 4. We are going to practice it again.
Yeah. When we try, I see now.
Yeah, it's okay.
Is it okay?
Yeah, I think so.
Yeah. See, when we try to do the figure of 4, if you are right. Okay.
Right.
Okay. When we are lifting the right foot on your left knee, we are trying to do for the right side. Okay. So there's no confusion. We are not doing for the left. We are doing for the right side. The stretching of your certain muscles on the back. Right. So this is a figure of 4. Now you, with your hands, you just put your, you can do it here.
Hamstring.
Hamstring. You can keep your hands just below your thighs for somebody which you cannot, cannot perform, or on the shin. This is for somebody which is quite normal, not affected. If somebody can do this, it's well and good. And if somebody is having problem doing that, you can do it on the below your thighs, right? So now you just relax your shoulders on the ground, not lifting your head. Now you pull your shin from both the hands towards your chest. Okay, hold it for say 10 seconds. Release gradually after 10 seconds. Okay. Here what we are trying to do is you release the muscle which is trying to compress the sciatic nerve. This is the best, stretching for sciatic nerve, sciatic nerve problem. Okay, sciatic nerve, we gradually, your pain radiates from your low back till your lower back of the thigh, till your back of the knees, till your hamstring. This is what happens in sciatica. Okay, it radiates. When pain radiates, that's sciatica. Okay, we can try for the other side. Okay, you can do it. Brace it, keeping the shoulder on the ground. Relax on the ground. Pull it towards your chest. Pull it, hold it. 10 seconds, then release. Right? Yeah. This for particular muscle is called piriformis and glutes, which compresses mostly, when the nerve is affected. So now we're trying to do for a single Single, okay, no.
Single leg, palm open. This
Single
one.
leg. This one. This one. This is for your left. All the left side back muscles. Okay, you're stretching your lower back muscles, not the upper back. Okay, this is for only for lower back muscles on the left side. Here on the left side. Okay, so you just pull it towards your chest, hold it 10 seconds. Okay, it's most effective way to do is you do it unilaterally. I mean single leg at one at a time. Okay, that's effective.
More effective
more-
than the
more-
double leg. Okay. Guys,
It's
is
very
that
effective.
everything which you can practice during the pain?
During the pain.
During the pain.
Now you can do it for the other side because that that helps the individual muscles of the one side at a time. Right? Pull it, keep it, hold it. Yes, and release. Now here, what we're trying to show is walking.
Okay.
Okay, both the knee flex.
What about my toes? Should I flex it or
Just release. Relax. Keep it toes down, facing. Parallel to the ground. Okay. Now what we're trying to do is a dynamic stretch. This is a dynamic stretch. Okay. You try to rock your body. Yeah. Yes. 1, 2. Not touching your head on to the ground.
Okay.
Okay. This is a rocking. This dynamic stretch is the best way to release all the back muscles, right from your cervical till your lumbar.
Okay. Without jerk, right?
Without jerk. This is for the entire back. Okay, this is not for your only low back.
It's like massaging your back.
Right. Dynamic is the best thing. Okay, you can do it 30 to 40 times in a particular
I
setting.
can go around 50. It's nice.
Yeah.
Exactly. All right.
Okay.
These three?
Yeah, these three.
Okay. We'll share these three again on the video.
Yeah.
As well as those one with for the frozen shoulder.
Right.
All well. I think we had one that's Sunil from last week. After the class, he was like, "It's lighter." I think Anubhav will also go back. It's better now after the workshop. But guys, you have to practice every day. Okay, everything it takes time to build up. The muscle also takes time to recover. Okay, and the muscle is just asking more attention from you. Okay, so it needs more care. That's about it. We have been careless about that particular muscle. All right. Okay, so sorry, sir. You know how I talk, right? So, any questions? Now we will go at the end of the class, and then we will go with the questions. We will start with our mindfulness, with sir, all of us waiting here. So I think all of us we know, but he is our Ajinkya sir, Ajinkya Meher, who's with us throughout. All right, sir, over to you.
Thank you so much, Preeti. I forgot the other sir's name.
Rinku, he's Rinku.
Rinku, hello, namaste.
Hello, sir. Namaste.
Thank you so much for conducting such a beautiful class, both of you.
Thank you, sir.
All right. We all can sit in Sukhasana in a cross-leg position. Keeping your hands on your thighs, keeping your back straight. Keeping your back straight, keeping your eyes closed. Keeping your eyes closed, bring your attention on your breath. The name of the posture is called as Sukhasana. Okay, Sukhasana means a happy pose. So Sukhasana is incomplete without a smile on the face. Sukhasana should look like Sukhasana. It should not look like Dukhasana. Your Sukhasana should look like Sukhasana. The Sukhasana should feel like Sukhasana. feeling of Sukhasana is very important. Sukhasana is incomplete without that feel. You should feel Sukhasana. You should feel your breath. You should enjoy your breath. Joining your hands in Namaste, center of chest. And chant one round of Om. Take a deep breath. Sahana Vavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavaditamastu Ma Vidvishavahai. Oh, Shanti, Shanti, Shanti. Namaste and good morning to everyone. Right, so conditioning is very important before we start anything, before we do anything. Like also in our life, if you have some goal in your life, you condition your mind accordingly. Okay, like for example, if you want to buy a car, you condition your mind that that's how I'm going to plan it. I'm going to buy a house. If I'm going to go to gym, I'm going to condition. Same thing happens with yoga. Okay, अगर आप बहुत थक के आए हो घर पर और घर पे air condition लगाया है, so you first switch on the air condition, like it conditions you, just makes you feel relaxed. Okay, it prepares you, it makes you feel fresh. That's why conditioning is very important before you start anything, any physical activity, whether it's gymming or whether it's a yoga, or whether it's a gymnastic, or whether it's you're going to a work. Before you start your work also, okay, like when you're sitting on the office chair, and before you start your work, before you just switch on your laptop, you're entering into your office. Okay, you just sit for 5 minutes. You just sit for 5 minutes and condition your mind. Just sit for 5 minutes and just condition your mind how you're going to do it. Or just relax your mind, but don't do anything. This conditioning will start adding more and more quality in your work, quality in your life. Getting what I'm trying to say, everyone? So conditioning is very important and it's beautiful. Without conditioning, we kar sakte hai. Okay, so I was saying that day in the class that अगर हम मिठाई की दुकान पर जाते हैं, so when you go and get a मिठाई, you say, अरे यार मुझे मिठाई देना, and same मिठाई goes to the temple, and when it comes out, it becomes a prasad. Same मिठाई है, मिठाई same है. It travels to one particular place, and it just came out, it becomes a prasad. Okay, खाने का gesture ही change होता है. मिठाई तो हम ऐसे खा रहे थे, okay, प्रसाद तो हम ऐसे खा. Okay, पूरा gesture ही change हो गया, पूरा हाथ का, feeling का feel भी change हो गया है. मिठाई तो ऐसा गपा गप ऐसा खाते हैं, प्रसाद हम. Okay, तो conditioning is also the same thing. काम ऐसे भी कर सकते हैं, योगा प्रैक्टिस ऐसे भी कर सकते हैं. सिर्फ मैट डाल दिया, स्ट्रेचेस कर लिया, स्वेट आ गया, बस हो गया. ऐसा भी कर सकते हैं और कंडीशनिंग करके भी कर सकते हैं. But you have to choose. That's what mindfulness is all about. You have to be. When I talk about mindfulness over here, I talk about a lot of awareness. Okay. And when I talk about awareness, there is a bhava which we have learned from our institute, the Yoga Institute, which talks about Gyan Bhav. Gyan means a knowledge. Okay. Bhava is the attitude. Okay. Gyan means a knowledge, and Bhava is the attitude. So formula for Gyan Bhav is AC square. Okay. It's called as AC square. A stands for awareness. C stands for coordination and concentration. Okay. So whatever activity you do in your day-to-day life can be done with AC square. For example, I'm talking with you. Okay, I'm talking with a lot of awareness. There's concentration. There's coordination between my mind, my breath, and my words, which I'm talking. I'm using a lot of Gyan Bhav. I'm talking. You are also using AC square. You're listening to me. There's a lot of awareness, concentration, a lot of coordination. Okay. So same ही चीज है. मिठाई वही है, सिर्फ आप उसके अंदर feelings डाल रहे हो, awareness डाल रहे हो, condition कर रहे हो. Okay. So all these small things really helps you in your life. It adds quality to your life. The whole idea what I'm trying to tell you is, जैसे कि मैंने कहा कि योगा ऐसे भी कर सकते हैं, सिर्फ मैट पे आओ, स्ट्रेचेस करो और चले जाओ, ऐसे भी कर सकते हैं. But once you start adding that prayer, the opening and the closing prayer, that feeling, that it adds quality to your practice, and same thing happens. It adds quality to your life also. That's a first thing which because I do apply, and I always say first apply, then you supply. Okay, unless and until you don't apply, you don't supply. Okay, so first you apply, and then you supply. So what I'm talking, what you're listening is just the information which I'm giving it to you. What I'm giving you is just information. Okay. Once you start applying it, okay, you will be using a lot of knowledge. And once you will start moving more ahead, it will become your experience. Then one fine day you will also start sharing with someone that मैंने भी ऐसा किया था, ऐसा कर सकते हैं, इसे conditioning कहते हैं. So maybe when I also go to my teachers, I first take information. And then I try and do some research about it, knowledge. Then I try applying in my day-to-day life, in my routine. That becomes my experience. And then I apply, and then I supply. So that's how your life also works. For example, if you're going to go to US, you first gain information where you're going to go to US, how you're going to go, which flight you're going to book. Okay, you're collecting the information. You go to the US, ghum rahe, fir rahe. You come back, you had a nice experience. Okay, so same thing with your body also. Okay, not going very much off the topic, and I'll not take much time of yours. Coming back to the body topic, when you have a pain in your body, for example, the topic for today is a frozen shoulder and a lower back pain. So for example, if you're going to climb a big mountain, if I keep you in front of a big mountain, if I tell you that, oh, now we are going to climb this big mountain, there will be some of you who will be saying that, oh, it's so difficult. Oh my God, it's so difficult to climb this mountain. Thak jayenge chadte chadte, you know. And there will be some of you who will be saying that, oh, it's so easy. We can do it. And same thing happens with your pain also. How do you see your pain is very important. Pain, like a frozen shoulder, or lower back pain, if you're going to feel and if you're going to think that, oh, it's so painful, it's never going to go away. Okay. So you start in that mindset. And if you're going to be like, oh, it's paining, okay, I'm going to repair it. It's going to get healed very fast. Okay. I'll repair it very fast. Okay. I'm going to work on it. I'll be taking care of it. Okay. And then only it will start curing. Otherwise, आप पेन के साथ जीना सीख जाते हो. Okay. Many of us ऐसा रहता है कि हम पेन के साथ में एडजस्ट कर लेते हैं. Okay. Yeah, I'm getting it, connecting with me what I'm trying to say. Okay, हम पेन के साथ में एडजस्ट करना सीख लेते हैं. हस्बैंड वाइफ की बात नहीं कर रहा, उसे अलग रखना है. I'm talking about our body pain over here. So you have to understand that what kind of person you have to talk to yourself within, that how you're going to see that pain as, oh, it's so paining, it's so difficult, it's so, you're going to complain about it, you're going to crib about it, or you're going to cry about it, or you're going to say like, yeah, I'm going to repair it and it's going to heal very fast. I'll be coming out of it very fast, because it does happen with most of the yoga practitioners who comes to us when they say like pain ho raha hai, तो आप pain को कैसे attend करते हो? Okay, with lot of mindfulness, with lot of awareness, with lot of love. You also have to love your pain. You also have to respect your pain. Okay, if you are going to fight with your pain, pain will fight with you. Okay, if you will fight with your pain, pain will fight with you. If you will love your pain, pain will be like, अच्छा ठीक है, मैं तुझे छोड़ के जा रहा हूँ करके. It'll go away. Okay, you have to learn to respect it. Then only it will slowly start moving out. Okay. Now, why does the pain comes in our body? So, for example, the fan above me. This is a small example of a fan. Okay. So, if I have to remove this fan, what I will do? There are 2-3 ways that I can remove this fan. Okay. Either I will hold the fan, pull it, or I will unscrew the fan. Am I right? Yeah. So same thing, whenever you're going to practice, whenever you're going to do any exercise, you have to unscrew your body. And how do you unscrew your body is with the mobility, the joint mobility. So whenever you start any activity, okay, Monishita's husband, especially for you, okay, Eva for you, Shushil, Dr. Apurva, Sarlaji, Sunilji, okay, whenever you start any practice, okay, start with a joint mobility. Once you start working with the joint mobility, joint के आजू बाजू के जो muscles है, उसका blood circulation बढ़ जाता है. The blood circulation बढ़ जाता है. Oxygen flow happens very nicely. Okay. Once the oxygen flow happens nicely, the blood is supplied to all the muscles. And the second stage is the stretching part or the strengthening part, whatever practice we do. But always whenever you start with any exercise, you start with mobility. Mobility of your neck, mobility of your shoulders, mobility of your spine, mobility of your knee. It takes only 5 minutes. Okay, I'll take you through to the joint mobility a little bit. Okay, just 5 minutes. We'll say hi to all the joints. I'm sure you all did this, but Priti, can you put yourself on a spotlight? Yeah. So we all can see Preeti on the spotlight. We all can do it together. It's very simple. Okay, it's very, very simple. Okay, starting with the finger joints. Okay,
Yes, sir.
yeah, starting with the finger joints. Both the hands in front, straight. Spread your fingers. Inhale. Exhale. Thumb in, make a fist. Make a fist. Yes. Exhale. Inhale. Spread your fingers. Exhale. Thumb in, make a fist. Inhale. Spread your fingers. Exhale. Thumb in, make a fist. This becomes the fingers. Okay. Now move your wrist clockwise, anti-clockwise. Nice. Inhale, palms up and down. Inhale, palms up. Exhale, palms down. Then interlock your fingers. Bring your palms close to your chest. Turn your palms out. And twist. No. Twist means like the twist, just twist the palms this way.
Okay.
Yeah, put it forward. Yes. Yeah. Yes. Again, bring your palms close to your chest. Turn your palms out. And you twist. That's good. Okay, now bring your hands in namaste, straight namaste only. Yeah, straight namaste. Then turn your palms. Turn your palms. Great. Opposite namaste. Interlock your fingers. Bring it in and out. Pull it in and out. Bring it back again. Bring it in and out. Do not unlock your fingers. And come back to the namaste position, opposite namaste. The hand which was down will go up. Change the hand position. Do in and out. And relax. So this was for fingers, then wrist, then forearms, then elbows, bicep, tricep. Then we'll go with the shoulders. Okay, just move your shoulders from front to back, up towards your ears and back. Go back, rotate. 1, from front to back and back to front. 3 times. Three times front to back, 3 times back to front. With lot of awareness. Okay, with awareness. Okay, especially for people who have frozen shoulder, you should be doing a lot of shoulder exercises. And very important is neck exercise. For frozen shoulder people, you should be doing a lot of shoulder and neck exercises. Okay, it's few neck exercises such as drop your ear to the shoulder. Come back in the center, inhale. Exhale, drop your ear to the shoulder, not your shoulder to the ear. Inhale, come back in the center. Exhale, drop your ear to the shoulder. Come back in the center, inhale. Exhale, drop your ear to the shoulder. Inhale, come back in the center. Exhale, drop your chin to the chest. Inhale, look at the ceiling. Exhale, chin to the chest. Inhale, look at the ceiling. Exhale, chin to the chest. And in the center, stay there. Look at the right side. Exhale, look at your right side. Stay there. Inhale, come in the center. Exhale, left side. Inhale, come back in the center. Exhale, right side. Inhale, come back in the center. Exhale, left side. And come back and relax. Great. Okay, so this was some joint mobility exercises. Pehle ka Preeti covered most of the thing, like the spine, cat and cow pose and everything. Okay, Preeti, can you make me host again? Okay, thank you, Preeti. So this was the sum. So the whole idea of me saying over here is, before you do any activity, especially in the morning, mornings body is more stiff. मॉर्निंग में बॉडी बहुत स्टिफ होता है और मॉर्निंग में बॉडी बहुत लेजी भी होता है. ओके, मॉर्निंग में बॉडी बहुत स्टिफ होता है और मॉर्निंग में बॉडी बहुत लेजी होता है, बहुत लेजी होता है. ओके, बट वंस यू start breaking this morning stiffness, okay, you will be active your whole day. Just the joint mobility and few stretches, just joint mobility and few stretches will help you to repair your body and to start your day. Okay, sirf 15 minutes pe chalega. Okay, students who are doing regular practice, not for you all. Okay. Okay, students who are not doing anything, if you're going to the office, if you don't have work, try and do. If you're doing gymming, you can do gymming in the evening if you want, like office jaane ke baad aisa routine rahega. But morning, give 10 minutes for a joint mobility. Okay, it will really help you. Okay, now the main topic which I'm going to talk today is about the 5 elements. The 5 elements. The first is the fire element. Okay, the opposite of fire is the water. Okay, so the first element is the fire. Opposite of fire is the water. Then the third element is the earth element, and the opposite of earth is going to be the space. It's going to be the space. और बीच में क्या बचा है is the air. बीच में क्या बचा है is the air. All right. So over here, what I'm going to talk about is stiffness which happens. Okay, for example, the back stiffness or the stiffness overall, maybe in the shoulder, maybe on the back, because we don't create space. Okay, because we don't make space in our body, the stiffness occurs. Because we don't learn to create space in our body, stiffness occurs. Okay, and the element which is going to help us to make space is the earth and the air. Okay, the earth gives the firmness. Earth se firmness banta hai. Okay, air is helping us to make the space in our body. Getting it what I'm trying to say over here? Okay, water और fire को हम थोड़ा सा बाजू में रख के वो अपना काम करते रहते हैं. Okay, water और fire वो अपना काम करते रहते हैं. For example, अगर आपने खाना खाया है तो fire अपना आप काम करता रहता है. Okay, but over here when I'm talking about a stiffness occurs because we don't make space. I'm saying it again. Stiffness occurs because we don't create space. Okay? So if we learn to create space in our body, the stiffness, for example, the frozen shoulder, or maybe the lower back stiffness, or the neck stiffness, or the knee stiffness, or the muscle stiffness, the spasm which occurs, okay, it reduces. I'm not saying it goes completely, okay. Or sciatica pain also, okay, a sciatica pain also. Someone has sciatica pain in the class, Priti was saying. So a sciatica, I have sciatica on both the legs. Okay, I have sciatica on my both the legs. So once you learn to create space, not only in the body, but using the help of the breath and using the help of the mind, okay, you will understand that ki body halka ho jata hai. Body halka ho jata hai. Okay, so we'll do a very small activity. Okay, we'll do a very small activity. You are sitting on the floor, so your legs are the earth. Okay, your legs are the earth. Your spine is the space. Okay, your spine doesn't have a space now. I'm going to put the air inside you, and your spine will create a space. Getting what I'm trying to say? I'll repeat again. Your legs are the earth. Okay, legs are the earth. Body, the upper body, khali hai. I'm going to put air inside your body, and we will try and create a space in your spine. Okay, beautiful it is. It's a beautiful practice. What you will do is take support of the wall, everyone. Keep your back against the wall. Keep your back against the wall. You can keep any position of your legs. If you want to stretch your legs out, if you want to sit in a cross legs, you can sit in a cross legs. You can rest your back on the wall. I want your earth should be feeling like earth. It is strong. Your legs are earth. It is very strong. It is very firm. Your eyes are closed. Your spine doesn't have space now. Imagine there is a lot of stiffness in the spine. Okay. Now अभी balloon में हम air कैसा भरते हैं वैसा हम air भरेंगे spine में. Okay. So I want you should inhale, feel the lift in your chest, and exhale, feel your stomach moving in. When you inhale, feel the length in your spine. Imagine someone is pulling you up. And when you exhale, feel your stomach moving in. When you inhale, feel the lift in your chest, feel the length in your spine. And exhale, feel your stomach moving in. When you breathe in, feel a nice length in your spine. Someone is pulling you up. And exhale, feel your stomach moving in. This feeling is very important. When you breathe in, feel a nice length in your spine. And when you exhale, feel your stomach moving in. When you breathe in, feel the length in your spine. And exhale, feel your stomach moving in. And when you inhale, feel a nice length in your spine. and exhale. Feel your stomach moving in. More 5 breath. Inhale, feel a nice length in your spine. And exhale, feel your stomach moving in. Inhale, feel a nice length in your spine. Exhale, feel your stomach moving in. Inhale, feel a nice length in your spine. Exhale. One more last breath. Breathe in, feel a nice length in your spine. Exhale. You can continue with the same breathing pattern if you want, or else you can just do a normal breathing for 2 minutes. And with your eyes closed, slowly you can slide down and relax yourself in Shavasana. Sleep on your back completely with your eyes closed only. Slide down in Shavasana completely. And let's not attach ourselves to the pain. Shavasana is a beautiful posture to let go. Shavasana is a beautiful posture to let go. So now, wherever you feel stiffness, if you feel stiffness in your shoulder, you feel stiffness in your lower back, you feel stiffness in your knees, you feel stiffness in your ankle, pay attention on that stiffness or the pain, and we will inhale. We are going to just imagine that pain, and we exhale, we relax that pain. When you inhale, you're just going to give a small thought about that pain, that here is my stiffness, and exhale, I relax my pain. Inhale and exhale, I relax my pain. And inhale And when you exhale, you relax your stiffness. And when you inhale, you exhale, relax that stiffness. And you inhale. And you exhale, you start letting go with your stiffness or the pain. And you inhale. And you exhale, you let go with your pain. You inhale. And when you exhale, you tell your mind to relax that pain. When you inhale and exhale, you relax that pain. And you inhale. And you exhale, let go with that pain. When you inhale, imagine that pain and let go with your pain. When you inhale and exhale, let go with the stiffness. Create more space in your body. When you inhale and you exhale, create lot of space. Inhale. And when you exhale, let go with the stiffness. And now start feeling lightness in your body. Inhale. Exhale, let go with your entire body. When you inhale, you let go with your entire body. When you inhale, when you exhale, let go with your body. When you inhale, exhale. Inhale. When you exhale, you relax. When you inhale, you exhale, you are relaxing your entire. Inhale, exhale, let go. When you inhale and when you exhale, let go with your stiffness and the pain. And when you inhale and exhale, feel the lightness in your entire body. And when you inhale and exhale, feel the lightness in your entire body. And let go with your body completely. And very slowly make movement of your body. Move your fingers and move your toes. Stretch your hands above your shoulders. Give a nice stretch to your spine. Point your toes out. Turn towards your side. Make a pillow of your hand. Turn towards your side and get up sideways in Sukhasana. Happy pose. Okay, your Sukhasana should look like Sukhasana. Sukhasana should feel like Sukhasana. Just feel the lightness in your body. Feel the lightness in your mind. Joining your hands in Namaste. Chant one round of Om to keep that. You can slowly open your eyes. Namaste. Some of you went off to sleep, I think.
Thank you, sir.
So that's how you can do a Shavasana little different way. That's what I used to practice. I still practice sometimes. Like when I say like stiffness is not in the body, stiffness is in your mind. Stiffness is not in your body, it's in your mind. And the more you start relaxing, especially before you go to bed. Okay, before you go to bed, just 2-3 minutes of Shavasana. If you feel any pain in your shoulders or pain in your lower back or in your knee, just do a very mindful Shavasana this way. Like just let go. Just tell your pain, relax. Tell your pain, relax. आप वो पेन के बारे में बात करते रहोगे ना सभी से, okay, और बार बार उसको अटेंड करते रहोगे ना, okay, आप वो पेन के साथ में रिलेशनशिप बना रहे हो. Okay, so उसके साथ में रिलेशनशिप नहीं बनाना. उसके साथ तो उसको थोड़ा सा कम ध्यान दो, उसको थोड़ा सा पैम्पर करो, उसको रिलैक्स करो, वो कम होता जाएगा. आप उसके बारे में बात करते रहोगे, वो दिमाग में it will always be in your head. You will be talking to this friend, you will go and talk to this friend, you will go and talk to this relative, ऐसा है करके. पेन के बारे में जितना बात करोगे उतना बढ़ते जाएगा. आप ही बढ़ा रहे हो. Okay? Not only the physical pain I'm talking about, otherwise also. Okay, so that's all from my end. Over to you, Preeti.
Thank you, sir. Thank you so much. I had a pain at the back of my neck, and it went away with the Savasana. Okay, it's too many classes sometimes.
Yeah.
Yeah. All right. Okay, so I wanted to show you. We always what do you supply? We have a t-shirt also AMI. So
We have a t-shirt also of AMY. Apply before you supply.
all right. Sir, actually, we were thinking that we'll keep the group alive so that there are people who are affected. They can also share because maybe
Yeah.
was like too less for us to learn, and we are learning from those who are not who have this thing, many inputs from those who are suffering the pain also. Okay, they're teaching us. Okay, so we are learning
Yeah.
from here in the workshop. Okay, is there shall we keep 5 minutes more of any questions if you guys have
Anyone like to share anything? You can let
any
us know.
questions? Yeah, you have left. All good? Yes, Beena ji.
Very nice session, Preeti. Thank you. Very nice session.
Thank you, Beena ji. Yeah. Okay, okay. Anybody? No questions. That's good. Yeah.
Eva has something.
Eva has a question. Yes, Eva.
Yeah, so I used to do Iyengar practice before, and I always had this lower back pain. And they said in your Shavasana, try and imprint your lower back by folding your legs in. So don't do a full Shavasana down, because again that curve comes at the your back. So should one do that, or should one do straight legs Shavasana?
Very true, Eva. You can keep your legs folded and you can do your Shavasana. But again, when you fold your legs and when you do a Shavasana, again there's a restriction happen in your knee because the legs are folded.
Okay.
Getting what I'm saying?
Mm-hmm.
So the Shavasana letting go is not happening.
Huh.
The surrendering is not happening.
Hmm.
So what you can do is take a napkin, roll a napkin and keep it under your lower back.
Okay.
So the arch, the curve which is there, that will be gone. And you can also play so I used to teach this military commanders some 7 years back. I used to teach them. So वो rifles उठा के उनका back ये हो जाता था पूरा और neck भी. So we used to give them a shavasana like a white napkin. उसको गर्म पानी में हम लोग निकालते थे और गरम नहीं but उसको थोड़ा सा warm कर देते हैं and we used to keep them under their neck and under their lower back and under their knee. And we used to make them do shavasana that way. It was so relaxing. So you can do that way also. Relaxing pattern. Okay. So folded leg is also fine. This way is also yeah.
Okay. Thank you so much.
Anyone else like to add something?
Thank you, Preeti. It was very nice. And I really feel relaxed, but many asanas I could not do, like this which you told me to do, stretch out. I just couldn't remove because it pains. So is it okay? Like I have to practice and do it, or whether I have some problem, that's why it's not happening?
Yeah, hi. So as Rinku had mentioned in the beginning, when your pain is during the frozen what do you call stage, okay, you have to practice those exercises or the postures which he had shared.
Okay.
He had shared. We'll be sharing with you in the group also. Those are else when the pain is there. Always in the class, I also always mention when the pain is there or when we have an injury, the muscle has to relax.
Okay.
The muscle has to relax that time. Allow the muscle to recover. So what Rinku had shared with us was what you can do during that time. Okay, small stretches, very safe stretches. That will be only stretches, not strengthening. Okay, so only particularly I'll label nicely and share it with you.
Okay. And with the frozen shoulder, does the grip also go? Like when opening a bottle, sometimes I can't open the bottle. I have to put a lot of pressure. So is that thing affect the whole arm actually?
Grip as such, there's nothing wrong with the grip of the hands or your forearm, but yes, slightly, indirectly that affects your forearm and grip, hand grip, due to the shoulder, that radiates somehow. But actually, the muscle of your grip, I mean your hands and your forearms are not affected, but due to the shoulder, indirectly that affects.
Means the muscle of the hands are not weaker.
Not
yeah.
weaker.
Yeah.
And your forearm and your grip, it's not weaker, the inability to perform your function is due to your radiation of the pain of the shoulder.
Okay.
True. What you
Thank
can do for that
Thank
is
you so much.
आप नींबू पानी पीते हो घर पे नींबू पानी?
हाँ.
हाँ, तो start having nimbu pani. Okay, cut a lemon and start squeezing a lemon.
Okay.
Yeah, okay. You can practice these exercises जहाँ पर हम बहुत नींबू निचोड़ते हैं. This is one exercise what you can do, and other exercise is you can put a pencil in your fingers.
Okay.
Okay, put a pencil in your fingers. Okay, and start squeezing the pencil from up and down.
Okay.
Okay, yeah. So all the 4 fingers you can put a pencil and start pressing the pencil like.
Okay.
Getting it what I'm saying?
Yeah, yeah.
ये 2 exercise you can start doing. First is नींबू निचोड़ना and second is पेन को अंदर डाल के आपको squeeze करना है. अगर squeeze करने नहीं जम रहा है तो दूसरे हाथ का help लो.
इतना भी पेन नहीं है, but while opening something like pressure जो देना होता है ना, वो pressure नहीं आता है बराबर. Many times.
Yeah. So आप नींबू का exercise you can start doing that.
घर पे सब टाइम पानी मिल जाएगा.
नींबू पानी मिल जाएगा.
And yeah. All right.
Okay. Yeah.
Anybody else? Last question. Yes. All good. Anubhav is okay. Anubhav, Bhujangasana. I'll keep on reminding Bhujangasana, Bhujangasana, Bhujangasana. Cool. All right. Yes, Pinky. Pinky wants to say something. All right. Okay, sir. Thank you so much, sir.
Thank you so much, everyone.
It was a
Thank
good
you so much, Preeti.
Yes, sir.
Thank you so much. Nice meeting you. So
All
I'll come to Manipur. For sure I'll come and meet you.
For sure, sir.
Yeah. All right.
Thank you so much, everyone. Have a great Sunday. See you all.
Thank you.
Bye, guys. Yeah. I'm logging.
Thank you. Thank you, sir. Thank you.
You. Parvaji, you went off to sleep in Shavasana.
No, I was here, but my mobile was turning on the other side. That is why I put it on this side. Sir, I wanted to ask you something. Can I do all the yogasanas, no? With this, whatever we are doing in the Yogashala, we can do everything, no?
You can do that, Sarlaji, yes.
Okay. Yeah. Anyway, you are there to guide me, but still I have to. Thank you, sir. Thank you, Preeti.
Thank you, Sarlaji. Thank you so much.
Thank you. Bye-bye.
Bye-bye.
Thank you, sir.
Thank you.